If you've ever cared for someone with dementia, you might know this feeling. As the sun sets, things change.
Yeah, for a lot of people with dementia, the evening brings this really difficult, confusing shift. So, what is actually happening during these tough hours? All right, let's dive in. Okay, so officially, it's a change in behavior that starts showing up in the evening or at night. And get this, the numbers are surprisingly wide. It affects anywhere from 2.5% to 66% of people with dementia. These are the symptoms that caregivers see most often, and they can be so distressing for everyone.
So what causes this?
Well, the answer is kind of complex, with clues from both inside the brain and out. First, let's look inside the brain. A key player is what's called the body's master clock.
See, this damage flattens the natural day-night rhythm, which leads to confusion about when to be active.
On top of that, it also messes with melatonin, the hormone that tells our body it's time to sleep.
And yep, research also points to genetic links, like the APOE epsilon 4 allele, which is a known risk factor. Okay, so it's not just what's in the brain. The environment plays a huge role in triggering these episodes.
Think about it. Poor light, weird schedules, not enough activity, it can all disrupt the body's clock. So you get this perfect storm. The person isn't sleepy, they feel active, and then they get disoriented. So, knowing all this, how can we actually help? The crucial thing is, there are strategies that can make a real difference. And the research is pretty clear. Non-drug approaches are often highly effective and a lot safer for the patient. All right, let's go through a few practical steps. These all focus on reinforcing a healthy daily rhythm. And even really simple things, like consistent daily walks, can have a powerful positive impact.
Now, medication can help control severe symptoms, but it definitely comes with some serious risks.
And this really shows why a personalized approach is so key. The best treatment depends on the main symptoms. So what this all means is that, therapy has to be tailored to the individual's specific needs.
This leaves us with a really important question. How can we shift from just reacting to preventing and supporting?